Hello, I'd like to welcome you on behalf of the Hertfordshire and West Essex Integrated Care System to this online panel in which we're going to explore all the issues around COVID-19 vaccines in relation to fertility, pregnancy and breastfeeding. My name is Anna Drew and I'll be facilitating our discussion today. I'll introduce our fantastic panel in a moment, but just so you know a little bit about me, in my usual day job, I work in communications part-time in the charity sector, and I'm also mum to an 8-year-old, and I'm currently unvaccinated. I'm waiting for the text message or the phone call from my GP to let me know that I can sign up to get my first jab. That's enough about me. It's time to introduce you to our health experts, and I'm really excited to be joined by these guys to answer all your questions. We have with us today Dr. Shiko Visvanathan, who is Consultant Microbiologist and Director of Infection Prevention and Control for the Princess Alexandra Hospital NHS Trust. We also have Nanda Shetty, who is Clinical Director of Obstetrics for the West Hertfordshire NHS Trust. We have Chi Kai Tam, who is Deputy Director of Medicines Optimisation and he's Chief Pharmacist for the Hertfordshire Community NHS Trust. We have Rabia Zilihuma, who is Consultant Obstetrician at the East and North Hertfordshire NHS Trust. And we also have Josephine Smith, who is part of the team who are working on the rollout of the vaccination programme in the local area. So welcome to all our panellists. Thank you so much for joining us. Before we let them loose on our questions, we thought it might be helpful just to give a very quick overview of the current official advice on pregnancy and the COVID-19 vaccine, especially because it was updated in April this year. There was a bit of a change, and the advice now is that all pregnant women should be offered the COVID-19 vaccine at the same time as the rest of the population. So that means it will be based on their age and on their clinical risk group. It's reassuring to note that there have been no safety concerns raised with any of the vaccines in relation to pregnancy. And in fact, around 90,000 pregnant women have been vaccinated in the US with no safety concerns identified there. There's more data available for the Pfizer and Moderna vaccines in pregnancy, which is why only those vaccines are currently being recommended for pregnant women. But if you're ever unsure about the current guidance, the simplest thing that you can do is search online for the Royal College of Obstetricians and Gynecologists, or RCOG, or for Public Health England, and you can find all the latest advice there. And of course, you can speak to your GP, your midwife, or your health visitor as well. So without any further ado, let's get to our questions this morning. And I think I'm going to go to Nanda first and ask about which pregnant women are being prioritised in the vaccine rollout. If it's mostly being done on age, which are the clinical groups that are being bumped up the list?
Apart from the age-matched group, the women with high-risk medical conditions, for example, diabetes, blood pressure, any severe asthma, many other high-risk medical conditions, women who work in the health and the social care sector, they are being prioritized as well. Obese women with BMI over 45, and also women belonging to the BAME category, Black or Asian ethnic minority groups, are being prioritized over and above the others.
That's interesting. And is that because people from minority ethnic groups have been worse affected by COVID in general?
Yeah, absolutely right, Anna. That's the main reason.
And are there any groups, perhaps you can answer this one as well, Nanda, who are particularly being excluded from the vaccine programme, who really shouldn't get the jab?
So fortunately, very few. If you are known to have an allergy to any of the vaccine components, for example, the polyethylene glycol, PEG, which is a component of the Pfizer and the Moderna vaccine. If you already know that you have an allergic reaction to this particular agent, then you should avoid it and go for an alternative, that's AstraZeneca. Similarly for AstraZeneca, if you're allergic to the polysorbate 80, which is a component of the AstraZeneca one, then you must go for the other alternatives. You would have known about this allergy situation previously. You may be allergic to some household products, cosmetics, medications, laxatives, which contain any of these products, and you would know it beforehand. Otherwise, if you have had the infection recently, or you're asymptomatic, it doesn't matter. You can still have there's no contraindications. You can still have the vaccination. If you're acutely unwell, however, you may need to wait to become better, maybe at least 4 weeks until your symptoms have subsided, and then go for the vaccine. Yeah, these are a few things I can think of.
Great, thank you. And I'm going to go to Rabia now, because it makes sense to start our conversation off by looking at fertility. We understand that some people have real concerns about whether the vaccine might affect fertility both in men and in women. Do we have any evidence around that?
Yes, certainly. I think there are, guidance, of course, from the Royal College of Obstetricians and Gynecologists. There is also guidance from the British Fertility Society. We've got a lot of information and data which has come from America, where the women has been vaccinated more in number, as you mentioned at the start of your talk as well. Then, of course, the other way to look at this one as well is that there were some women who got pregnant while they also had their first vaccination as well. So there is a lot of information available about the safety of this while the women are in the reproductive age group to consider that. There is no contraindication and there is no evidence yet to suggest that the women should not consider having the vaccination if they are planning to have the baby. Some women might be going through the IVF treatments and rest of the things, so those women can consider having the vaccination as well. If, for example, someone wants to delay the treatment before they get protected against the COVID-19, then they can choose to do that as well. So have your vaccination, and then you could, start your treatment afterwards as well. Now, in terms of the rest of the thing, what I would advise the women is that if you are, planning to have the treatment as well, having the vaccination sometimes can make you feel rough. There are some side effects of, these medications as well. So it might be worth that you wanted to think of delaying for a few days before you actually go for your any of the treatment plans for the fertility, because some of these medications can make, these vaccinations can cause side effects of feeling unwell, feeling temperature, aches and pains, and the rest of the things, which will be covered later on as well. So I think I would advise the women to go for, the vaccination. And then, as I said, there's a lot of information about for those women who had the vaccination and got pregnant. And especially, I think the interesting fact is that the women who had the COVID itself as well, and then they have recovered over, the next few months as well. Some of these women have also got pregnant as well. So it does not seem to appear that COVID affects, fertility or any of the parameters, either for men as well as for women.
Great. And so actually, whether it's IVF pregnancy or natural conception, there's no evidence that it should interfere with conception, but actually that you might want to make some practical decisions about if you're going to have the vaccine, you might feel rough for a few days, to actually try and arrange around, any planned fertility treatment so you don't get a double whammy of feeling ill.
Yes, and I think one other thing what I wanted to add on is that some of the fertility treatment plans include having, anticoagulation as well to prevent the risk, of the miscarriage. That's the protocol of these ones. So there is no contraindication for the women to have those treatment plans as well as the vaccinations as well. And just like general vaccination advice is that, as Nanda has considered as well, if there is any contraindications, or to have a discussion with your physician before you actually embark pregnancy as well.
Great, thank you very much. I think we're going now to Josephine, who's working on the rollout of the vaccine locally. And we've got a question here from Hannah, who's a healthcare worker in her 30s, and she would like to receive the vaccine via her work, but because of her age, she's not actually eligible yet to get that. Can she choose to have Pfizer or Moderna at work rather than the AstraZeneca jab, which we know is now not being recommended for pregnant women?
Hello everybody. Yes, we've made local arrangements for the Pfizer and Moderna vaccines to be available to pregnant women and other people who need to be offered an alternative to the AstraZeneca vaccine for clinical reasons. At the moment, Moderna is available at our Robertson House venue in Stevenage, and Pfizer is available at 3 of our primary care settings, one in Harlow, one in Boreham Wood and one in St Albans. Patients can be referred to one of these sites by their GP or midwife, and we're also really pleased to hear literally in the last few days that the National Booking Service will shortly be amended to allow people to book into specific vaccine appointments in line with the JCVI guidance. So once this goes live, this will give patients more choice of location to access an alternative vaccine where it's clinically appropriate to do so.
Great, thank you. We've got a similar kind of related question from someone who's 20 weeks pregnant, and they're saying, you know, how can I ensure I get the Pfizer or the Moderna vaccine and not the AstraZeneca? Can they just kind of turn up on the day and say, actually, no, I can't have that? How does it work?
So no, it's really important people do make an appointment to make sure that they are offered the correct vaccine for the clinical scenario that they're in. So as I said, at the moment, they do need to be referred by their GP or midwife into the sites that we currently have available. But very, very soon that will be a functionality of the National Booking Service, so it'll make it a little bit easier for everybody. But yes, it's really important they make an appointment and not just turn up.
Great. Thank you, Josephine. Now, I've had a note from Chikai to say that he can add to the question on fertility, particularly with relation to male fertility. Chikai, you've got some light to shed on this for us?
There's a lot of studies going on about how COVID in the US especially has actually adversely affected men more than women. And in fact, studies have shown that fertility is actually quite badly affected by COVID itself. Whereas there's no evidence to suggest that fertility is affected by the vaccine. I think that goes to support the case for men to get the vaccination.
Thank you. So when you're weighing up the risks, you have to think about the risk of getting COVID versus the risk of getting the vaccine, and remembering, I suppose, that actually the vaccine is about protecting us from this illness. I think we might stay with you, Chikai, for our next question. Which is on AstraZeneca. We know that some pregnant women have already had their first dose of AstraZeneca, or perhaps had their first dose of AstraZeneca and then discovered that they were pregnant, and we now know that it's not being recommended for pregnant women. And can you first explain why it's not being recommended for pregnant women?
The JVCI, the MHI, undertook a lot of studies into the data available. And it's the overall risk of clotting. Being pregnant itself puts you into a thrombotic state and makes you more prone to getting clots anyways. And obviously on the very rare chance that the AstraZeneca vaccine could give you a clot, it was decided overall the risk benefit sways to the pregnant population having the Pfizer and the Moderna vaccine, which isn't associated with the clots that AstraZeneca has. However, if you've had the AstraZeneca vaccine already and then you become pregnant, you have two choices. The general consensus and general recommendation at the moment is that you complete your course of vaccination with the same drug. And if you've had AstraZeneca in the first dose and you've not had any adverse effects such as the clots, then the chances are extremely unlikely that you will suffer from any adverse effects having a second dose. Most adverse effects such as the clots happen within a 5 to 14-day period of the first dose. And in a lot of cases, it is an immune modulated response. And therefore, if you have it, you will get it. And as such, for a pregnant woman, you have two options. One is to take your second dose at the intended 12-week interval, or the second would be to receive your dose after you've given birth. A risk-benefit analysis should take place with an appropriate healthcare professional. So, for example, if you are in a high-risk profession, it may be desirable that you actually have the second dose within the 12-week period. However, if you don't have other high risk factors, you may choose to delay your second dose of vaccination until after giving birth. A lot of the data suggests that immunity is maximized whilst we stick to the 12-week interval. However, this is not cut and dry, and having the vaccine postpartum would not necessarily sort of be detrimental in terms of your immune response. You will still get the added protection.
Thank you. And just for real clarity about the risks around AstraZeneca, I think the statistics are something like it's 4 per million seem to get these rare blood clots, and there's 1 death per million. So we're talking kind of astonishingly small risk figures, but nevertheless a risk that people need to factor into their decision making. I think we're going to hear from Nanda next, and then I think Rabia as well has something to say on this. So Nanda.
So basically, I just wanted to add to what Chika has already mentioned. The mechanism of this complication of thrombosis is very different. It is immune mediated. So your pre-existing thrombotic risk in pregnancy has no direct relationship with your risk of getting this complication, the vaccine-induced thrombotic thrombocytopenia. And the younger you are, the more likely you are to have this risk. And also people who have experienced heparin-induced similar situation, thrombotic thrombocytopenia, which we call as HIT, the same clotting in very unusual vessels like the brain vessels, the certain vessels which normally you don't see clotting so much in. If people have already experienced this, it's best they avoid the AstraZeneca vaccine, as the mechanism is quite similar.
Thank you, Nanda. That's really helpful. So actually we're saying that although pregnancy increases your risks of blood clots more generally, it doesn't increase the risk of this kind of blood clot. That doesn't combine with the AstraZeneca to make for an exponential increase or anything like that.
That's right, Anna. Thank you.
Thank you. Rabia,
Yes.
Where are you? Can you add something on vaccine choice?
Yeah. Thank you very much. I think I wanted to add to Nanda's point as well that the pregnant women have got, in fact, the choices of having the 2 vaccinations. That's why they have been offered before the revised advice from the JCVI. The reason the JCVI has taken this approach of either Pfizer or Moderna is because they have got more data available on the safety of this in the pregnancy. And that data comes from US, about 90,000 women. So in terms of the women who had the AstraZeneca in this country before this advice change, there hasn't been any concerns about the risk of thrombosis in those women. And as Nanda has said, the mechanism of the thrombosis is a really different. It's not the same thrombosis or the clotting risk as compared to the general thrombosis, when the people get clots in their legs or chest or anything. So this is an immune response to the medications which they have been exposed to, and how does their body react to that. So if, for example, someone has been offered AstraZeneca before, and as Chika has actually mentioned as well, that if you have been offered another vaccination, it's absolutely safe to consider the AstraZeneca in that situation as well, because most of the risk of the clots, immune clots, what we have seen is with the first vaccination rather than the second dose of the vaccination. So they can have a choice and have a discussion with their healthcare physician about it. I think again, in terms of the choices, I mean, now there is another study which is happening with the RCOG and UK TIS, which is UK Tetralogy Information Services, and as well as UCOS, which is UK Obstetric Surveillance System. So they are doing a study in looking at all the women who had the vaccinations up till the March. And most of these women were actually offered the AstraZeneca vaccine as compared to the Pfizer. There's a mix, but majority of them, would have had that as well. So hopefully that more information will come through about the AstraZeneca while the women were pregnant as well. But I think the reassuring thing here is that we haven't come across any problems in terms of the AstraZeneca to the women who had been exposed to this as well.
That's very helpful, thank you. And I think we hear blood clots, and to someone who's non-medical like myself, we think all blood clots are the same and have the same kinds of causes, but it's helpful to know that there are actually some quite significant differences. Shiko, I think you've got something to add as well.
Yes, can I just say that the information from the yellow card system is constantly updating the data about the blood clots, and as we move along the timeline, the incidence has increased from the figure you mentioned of 4 per million. It's now thought to be around 10 per million for the first doses. With the second doses, 5.9 million second doses of AZ have been delivered in the UK, and there have been 6 cases associated with the second dose of vaccine. So it's only time really that will tell us about the true incidence. And, always with any new vaccine rollout, until millions of people receive the vaccine, you can't really tell the exact incidence of extremely rare side effect. So we will have to wait and see, but to be reassured that anyone who presents with symptoms of these blood clots is very carefully managed. And there is now an expert central panel based at UCLH Hospital, where there is a daily MDT from any hospital that can ring through and get expert advice on management. And so more and more patients are actually surviving and doing okay, despite having a complication like a blood clot.
Thank you, that's very reassuring. And we've mentioned a few jargon things, so I'm going to do it just a stop while we explain some of those things. Who wants to tell me what JCVI stands for?
Well, I can do that. So that's the Joint Committee on Vaccination and Immunization. And that's the committee really that decides on all the vaccines used in the UK, even the childhood vaccination program, everything that a baby receives, a pregnant woman receives, etc., goes through that panel. And it's composed of, a large number of experts who give their opinion, weighing up all the risk factors, etc.
Thank you. And you also mentioned the yellow card system. Can you explain a little bit about that? Because I don't think people are familiar with that system.
Okay, so the yellow card is a system that has been in place for many, many years, and it's a medicine safety point where you can just enter. Usually it's the physician in charge, or it could be a pharmacist who enters whatever the side effect and submits it directly online. So it's a very useful system that is in place in the UK for all medications, but it includes vaccine associated side effects. And if you look at the MHRA data, a lot of it is based on the yellow card submissions. And this particular side effect with the blood clot, what they're looking for is a blood clot associated with a low platelet count. It's not a blood clot or a low platelet count in isolation, it's the two together. And when the yellow card submission comes, there is a group that assess it immediately, and then they could get in contact with the original clinician and ask for more information. And that is the way that all the evidence is being accumulated more and more about all the side effects, from a sore arm right through to, a serious side effect.
Great. Thank you. I think I want to move on now to more specifically around the risks in pregnancy. And I think more broadly, what I'm hearing from the panel is that generally speaking, we believe it's safe. There's no evidence to indicate that it is not safe to have the COVID-19 vaccine, any of the COVID-19 vaccines, particularly Moderna or Pfizer, during pregnancy. Can anyone, perhaps Chikai, you can come in on this, give me a little insight into, obviously pregnant mums, their major concern will be, is this going to do anything to my baby? Is my baby safe? My baby hasn't chosen this. My baby's not at risk of COVID-19 right now because it's perfectly safe in my tummy. If I have the vaccine, will it affect my baby as well as my health?
From the 90,000 patients we know about in the US, there has not been any concerns that we could think of where a baby has suffered from harm specifically from the vaccine. And over here, we are also very confident of that based on the data that MHRA has seen, as Shiko said, the yellow card system is very robust. It's how we manage a lot of side effects and adverse effects as a product develops, which is essentially what we're doing here. I know Rabi also had something to add about sort of immunity for the child and actually about protecting the fetus.
Yes, I think there is more information there. There has been study on the checking the immunity for the mother as well as, you know, through the baby as well when they were born, especially in the US. You know, these studies have been done as well, and what they have found is very reassuring that the mothers who had the vaccination, their babies also have the immunity, and that's the same thing I think with all the vaccinations which we advocate for the mothers in the pregnancy as well. So the benefit is twofold always, you know, protecting the mother of these infections in pregnancy and also developing immunity, which helps, you know, to cross the placenta to the baby, and that immunity also helps, you know, the child as well when they are exposed to these diseases afterwards, not to get ill. So I think that's very also reassuring information which has come through as well, that it also protects the fetus and it helps them to develop that immunity against the infection as well.
That's really encouraging. And it might just be helpful if someone could give us a very brief, and time is cantering away, but a very brief overview as we compare risks around what the risks of actually catching COVID-19 during pregnancy might be to the mum and the baby.
Can answer that, Anna?
Thank you.
Yeah, so I think what basically it is, the information we have got so far is that the risk of the mothers catching, you know, the pregnant women catching the COVID-19 in pregnancy is pretty much same as compared to the general population. The risk of the disease severity is also pretty much same as well, but the problem is that if the pregnant women get this disease in the third trimester of the pregnancy, then the risk of deterioration is slightly more as compared to the women who are in the non-pregnant phase, because of their physiological changes which happen in terms of their, you know, the lung capacity and the breathing and rest of the things, and advancement, you know, of the full-term uterus and how it affects their own breathing as well. So taking into all this context, so the risk of them going into the intensive care unit or risk of them having the premature birth are much higher if they have the disease, you know, if they catch the disease in the third trimester. But we have got a lot of information on the women who were COVID positive, but they did not have any higher risk themselves. Most of them, in 3/4 of the cases, they were asymptomatic. The other thing which is important is that there is no also evidence of the babies catching, you know, the increased risk of COVID in utero or, you know, when they were born. And at the same time, what I think the women needs to be a bit more careful is that I think there was one point I was going to say about that try to, I think the vaccination is one way that you could actually minimize, you know, that risk as well. But yeah, so I think the other thing which I wanted to make sure is that, you know, women get that message that the women who are from, you know, the Black ethnic minority group, the women who might have some other risk factors like obesity, they've got other health conditions like, you know, sickle cell disease or, you know, chronic kidney disease or some other medical health problems for which their immunity might be lower as well. So they are at more risk of having the complications, especially I think there's one more group is the diabetes. So any of these women, if they catch COVID-19 in pregnancy, the advice is that they should seek help earlier if they are getting any symptoms or they are getting unwell, because their risk of deterioration is seen to be much higher as compared to the women who do not have any of the other risk factors together with this.
I'm going to go now very briefly to Chikai and then to Nanda before we take our last question, which is around breastfeeding.
Hi, I just wanted to add a bit more to Rabia's points. As pharmacists, we often get asked about drug use in pregnancy, and actually the drugs that can be used in pregnancy is more limited compared to drugs when you're not pregnant. And I suppose my point is, if you do catch COVID whilst pregnant, treatment options, should your disease be quite severe, may be limited. And that again goes to support the case for getting vaccinated.
Thank you, that's really helpful. And Nanda, you had something to add as well.
And just to add some figures to the talk, basically around 10% of these symptomatic women will end up in critical care, and around less than 1%, that is 0.6%, are going to unfortunately succumb to this as well. So these figures have to be borne in mind as well. Thank you.
Thank you. And perhaps, Nanda, we could stay with you for our last question, which is around breastfeeding and the vaccines. Is there any evidence, any concerns around women who are breastfeeding having the vaccine, whether they're passing anything on in their milk to their babies, or whether they are more vulnerable perhaps to allergic reactions of the kind we've flagged that might be maybe some people might just naturally have to the different types of vaccine?
Yeah, although there's lack of safety data for these specific vaccinations in breastfeeding, there's no real mechanism by which any of these ingredients can go across to the baby and cause problems. However, we do know, as Rabia had mentioned earlier, that the antibody protection, the level of antibody in the mother is almost proportional to the level of the antibody seen in the baby. So there is a protective element to it. And you should also not stop breastfeeding for any reason, because there are other benefits of breastfeeding as well to take into account. Thank you.
So we know that breastfeeding is good for babies as well as for mums, and actually breastfeeding, having had the vaccine, could also be beneficial to your baby rather than, as far as we know, rather than offering any additional risk.
Yeah. Thank you.
Okay. I'm afraid that time has just gone away from us, and I'm sure that people will have far more questions. I'd like to offer my thanks to the panel for all of their insights and expertise. If you know someone who might benefit from watching this panel discussion, please do share the link with them. And don't forget that if you are unsure at any point about the latest advice, because we know it's all evolving, for any of the COVID-19 vaccines in relation to pregnancy, fertility or breastfeeding, you can just search online for RCOG, which is the Royal College of Obstetricians and Gynecologists. You can also visit our local vaccine information website at covid.healthierfuture.org.uk, and of course please do speak to your doctor, your midwife or health visitor if you have any specific questions. Again, thanks to our panel.